In this video, we're going to talk about prolapse and aging, why we get it, and what we're going to do about it. I'm Carly Wallace. I'm an experienced pelvic floor physiotherapist who specializes in prolapse. I own and operate my own pelvic floor physio clinic, and I also have an online educational and exercise program for patients to go through from the comfort of their home. So if you're not exactly sure what prolapse is or what it means to have prolapse, or you're not sure how to tell if you have one, first watch my quick 8-minute video that dives into what exactly it is and 3 steps you can do to tell if you have one, and then come back to this video. One of the big reasons that we get prolapse as we age has a lot to do with hormones. And we often think about that post-menopause phase. Well, typically it will happen quite a distance post-menopause. Essentially, during our life, during our menstrual cycle, our estrogen levels will rise and lower throughout our menstrual cycle. When we hit menopause, our estrogen levels plummet to basically nothing, and then they stay there for the remainder of our life. Estrogen has a huge job in the integrity of our tissue in our pelvis. So the longer amount of time that we've gone from menopause, meaning that the longer amount of time that we've gone since having estrogen running through us, the chances of prolapse can increase. Estrogen's job within our pelvis is to keep our tissue stronger. And so the walls of the vaginal canal will thin and weaken with time, and that will cause that either that bladder, that uterus, that bowel to fall into them further. Again, our also job of estrogen in our pelvis is to keep our muscles stronger. And so our pelvic floor muscle can get a little bit weaker and weaker and weaker with time. We know that pelvic floor is the shelf that those pelvic organs sit on top of. So with the tissue in the walls of our vaginal canal getting thinner and weaker, and the floor of our pelvis getting weaker as well, that will contribute to prolapse worsening with time. We may have had some of the tissue damage during childbirth, or some of the other causes of prolapse might have happened already, but it's that tissue weakening that can start to show up some of those symptoms of prolapse, that heaviness, that bulging sensation, things wanting to fall out, things actually starting to drop and fall out because of our hormones. That takes us next to the very important question of what we're going to do about it. And typically you have 3 main options. Number 1 being exercise, number 2 being a pessary, number 3 being surgery. So let's kind of dive into exercise a little bit more and when that might be appropriate for you and what kind of exercises are going to be best. So while most of us have heard of Kegels, which is just the name they gave to an isolated contraction of your pelvic floor muscle, so your pelvic floor being all that red that you see in the bottom, so that big bowl of muscle sitting in the bottom of your pelvis. So a Kegel is when we squeeze and lift that muscle. That's what that bowl is going to do. We can think about a Kegel as, if you're sitting on the toilet and you had to stop your flow of urine halfway through. You can also visualize picking up a marble up into your vagina. We shouldn't see outside, your bum shouldn't be squeezing, we shouldn't be clenching through our abdominals. All the movement should be happening from the inside. So that's our basic Kegel, but is that really enough to resolve a prolapse? No, probably not. That Kegel is just the very beginning stages, just isolated, contracting that muscle. But we need to do more than just that. Our pelvic floor is a really important muscle in terms of how we actually function and use our whole body. When we do things like cough or laugh or sneeze, our pelvic floor is supposed to reflexively contract or do that Kegel automatically for us. When we go to lift up something or push or pull open something like a heavier door, our pelvic floor is supposed to contract naturally for us to protect our organs, to protect our core, to protect our spine and our pelvis. A huge part of weakening or aging is that a lot of those automatic responses of our pelvic floor are not working for us anymore. You can even try doing a harder cough. And what do you feel down in your belly and your pelvic floor? When you coughed, did your belly push out into that cough? Or when you coughed, did your belly pull in? That also is indicating what is happening at the level of your pelvic floor. If your belly is pushing out, it means your pelvic floor isn't contracting the way that it's supposed to protect your organs from dropping. If you, right, and so that can, over time, over the span of our life, weeks, months, years, if we're every time we're coughing, laughing, sneezing, and putting more pressure down onto our prolapse, pushing on it down, that can also make things worse. And so there are reflexive exercises that you can practice that helps to not only strengthen, but helps to get that reflex functioning again for you. Again, same when we lift something heavy, push a door, pull open a door. We need our pelvic floor to start working for us. And so we need to incorporate exercises that add movement, that add load to them, so that your pelvic floor can learn how to A, be strong enough to counteract against that load, and then B, to get it working so that it's starting to do it automatically for you again. If you're sitting in your chair, in your bed, just doing Kegels before bed every night, that's not going to help that extra pressure that you're putting on it when you're lifting up a bag of potatoes or a case of water, or when you're coughing or sneezing or laughing. It's not going to help that pressure that you're putting on it with those activities. So 2 things you can try just to get your pelvic floor started in terms of adding some extra load to it or adding some intra-abdominal pressure. First thing is take a ball or a pillow and put it in between your knees. Now, can you do a Kegel? So I'm going to think about lifting that marble up into my vagina. I'm holding my marble up there as I squeeze the ball. Okay, so I lift up my marble. I'm going to squeeze the ball. So try not to let your marble drop as you're squeezing. So here I am lifting my marble. I'm adding some load between my knees by squeezing and trying to hold my marble up there against it. The other thing you can try in terms of the intra-abdominal pressure is try it with something like a candle blow. So when we exhale more sharply, we're adding intra-abdominal pressure that can over time push down on our organs, as we described before. So can I try Kegeling as I blow out my candle? So I'm picking up my marble really quickly at the same time. Can you try coordinating that? And it might take a little bit of practice and feel very awkward to start with. So that gives you a little bit of a glimpse into a couple of the exercises that you might see inside my online program, Restore Your Pelvic Floor for Prolapse, where it gradually builds and takes you through the exercises that you need to do to keep progressing and strengthening your pelvic floor in the ways that are going to help your prolapse the most. Research shows that if you have a stage 1 or stage 2 prolapse, doesn't matter what kind, that you have an excellent chance of resolving your symptoms with exercises alone. When you have a stage 3 prolapse, so it means it is starting to protrude, maybe not all of the time, but some of the time is starting to protrude beyond the opening of the vagina, that your chances of improving with exercises are good. We're not going to make your prolapse a stage 0 with exercises, but you can often rid your symptoms, meaning that you're not noticing that heaviness, that bulging, it's poking out a little bit less. When we have a stage 4 prolapse, meaning that it's way bulging beyond the opening, and it's likely spending a large part of the day there, that your chances of improving that with exercises are much less, unfortunately. Okay, and now let's talk about the other 2 options, being a pessary or surgery. A pessary is a medical grade device that a doctor would measure for you and then prescribe and insert into the vagina. So this is an example. This is quite a small size. This is an example of a ring pessary. This is an example of a cube pessary. There are all sorts of other different shapes and sizes. How it works is the ring pessary, the gynecologist or doctor would insert it into the vagina and get it in the right position, and then it opens up. And so that's helping to keep open the walls of the vaginal canal so that no organs are falling into it. Similarly, the cube pessary, again, it would insert into the vagina. It suctions a little bit around the walls so that it stays in place. This is here just to help take it out when you're ready. And so it's helping to keep those walls of the vaginal canal open so that things, again, aren't falling into them. There are other different sizes. There are pessaries designed for you to learn how to take in and out yourself. Some of the pessaries the doctor would put in, it would stay in there for about 3 months at a time. You have to go back every 3 months. They take it out, they examine it to make sure that no damage has been done to it. They'll wash it and they'll insert it back in for you. Pros of a pessary: often people will do a pessary and do some strengthening at the same time. It keeps their symptoms at bay because I'm not feeling that heaviness, bulging. Cons of the pessary are sometimes it can be difficult to get it fit to the exact size. Some people report that they feel that they're uncomfortable, or that they might shift and not completely stay in place all the time. And then obviously you have to go back to the doctor every 3 months or so, which can be a little bit time consuming. The last option is surgery. Now, it's obviously always good to avoid surgery when you can. Sometimes it's not possible, right? And we need that surgery to go in and fix that prolapse. There are many different kinds of surgery depending on the prolapse that you have, the integrity of your tissue, and sort of where and how far that prolapse is falling. And having a surgeon kind of assess you, they'll give you the best kind of idea of what surgery would be appropriate for you. It is always a good idea, both before surgery or after surgery, that you do some pelvic floor strengthening to try to increase the likelihood that your repair stays repaired. Thanks for watching. Drop me a comment if you have any questions, or if you want any more information on my exercise and educational prolapse program. You can click on the link below.